The dog had never been protective of anything in 3 years. From the moment they brought the baby home, the dog wouldn't let anyone touch him, not the grandparents, not the health visitor, not the midwife, only the parents. Nobody understood why. 3 days later, a doctor ordered an X-ray. This is that story. Caleb arrived on a Sunday in April. Full term, healthy weight, good upjar scores, the standard reassurances of a birth that had gone as planned. Delivered with the specific relief of a medical team confirming that everything was where it should be. Maya had been in labor for 11 hours. She was 33, a primary school teacher, a woman of organized practicality who had prepared for the birth with the same methodical thoroughness she brought to everything, and who had found, when the moment arrived, that no preparation was adequate for the specific enormity of it. Joel had been beside her throughout. He was 35, a civil engineer who worked on infrastructure projects that frequently took him away from home for weeks at a time. A fact of their life together that both of them had made peace with, and that Maya had been managing alone for long enough to be good at it. He was home for the birth. He was due back on site on Thursday. They brought Caleb home on the Monday. Brody was waiting. Brody was a 3-year-old golden retriever, the specific warm gold of the breed at its best, a dog of such reliable and uncomplicated sociability that their vet had described him at his last check-up as one of the friendliest dogs she saw. He had never growled at a visitor. He had never guarded a toy, a bowl, a space. He had, in 3 years, given nobody any reason to think of him as a dog who would place himself between a person and anything. He met them at the door. He sniffed Caleb in the car seat with the thorough attention of a dog processing new information. He followed them inside. Maya's mother arrived at 2 o'clock that afternoon to help with the first days. Brody moved between her and Caleb, not aggressively, not with a growl or a raised hackle or any of the signals that mean danger in a dog, just present, positioned, immovable in the specific way of a large dog who has decided where he is standing and has no intention of moving. Maya's mother tried to reach for Caleb. Brody leaned. "He's just excited," Maya said. "New baby smell. He'll settle." He did not settle. By the end of the first day, it was clear that Brody was applying a rule that nobody had taught him. Maya could lift Caleb. Joel could lift Caleb. Nobody else could get close enough to try. The grandparents, the health visitor on day 2, the community midwife on day 2, all of them met the same immovable golden dog between themselves and the baby. Nobody was hurt. Nobody was threatened. The dog simply would not move. And nobody, not Maya, not Joel, not the health visitor, who had been doing this for 14 years, understood why. A golden retriever who had never been protective of anything in 3 years, a 6-week-old baby, a dog who suddenly wouldn't let anyone near him, not aggressively, just immovably, and who kept it up for 3 days until a doctor ordered an X-ray. This is a story about what a dog heard in a baby's body that nobody else in the room could hear, about the specific pain signals that fall below conscious human perception and above a dog's detection threshold, and about a health visitor who mentioned the dog's behavior almost as an aside and changed everything. Subscribe now if you haven't already. Ring the bell, because this story is one that every new parent needs to hear. Before we go on, has a dog ever behaved in a way around a baby or a child that you couldn't explain? Not aggression, not jealousy, something more specific than that. A positioning, a persistence, a behavior that didn't fit the dog you knew? Tell us in the comments. Because what Brody was doing for 3 days has a scientific name. And by the end of this story, you will never dismiss an unexplained dog behavior around an infant again. Now, back to Maya, who is about to call Joel on day 2 and tell him that the dog still won't let her mother near the baby, and who is starting to feel something she can't yet name. Maya and Joel and Caleb and Brody are characters we created. The osteogenesis imperfecta, the 3 days, the X-ray, these events are fictional. But the science underneath them is real. The documented capacity of dogs to detect pain signals in humans through vocalization frequencies below conscious human perception, through the biological stress markers produced by a body in chronic pain, through the specific biochemical compounds that pain releases into breath and skin, is supported by a growing body of research. Dogs have been documented responding to pain states in infants, in post-surgical patients, in people with chronic pain conditions, before the pain was clinically identified. We made these characters so the truth underneath them could be told as fully as possible. If this story makes you think differently about your dog's unexplained behavior, that is the point. Maya had wanted a dog before she wanted a baby. This was not a moral position. It was a sequence. She had grown up in a household without animals, her father allergic, the question never seriously entertained, and had spent her adult life quietly aware of the specific absence of it. Not acutely, just as a low background note. The sense of something the house was missing. She had adopted Brody at the end of her first year with Joel. He had been 8 weeks old. A golden retriever from a litter her colleague had mentioned, and she had driven 40 minutes to see him with no firm intention and come back with a puppy in a cardboard box on the passenger seat. Joel had come home from a site visit in Birmingham to find a puppy in his house. He had sat down on the kitchen floor. The puppy had climbed onto his lap. "We're keeping him," Joel said. It was not a question. "We're keeping him," Maya said. They had named him Brody after a street in Edinburgh, where they had spent a weekend that first year. A piece of private geography that meant something to both of them, and that the dog carried without knowing it. Brody had grown into his name and his household with the easy confidence of a dog who has been well handled from the beginning. Maya had trained him with patience and consistency, the same qualities she brought to her classroom, the understanding that reliable behavior in any creature required reliable input. He had responded with the specific eagerness of a golden retriever who finds learning intrinsically rewarding. He was, by any measure, a good dog. Joel's work took him away regularly. Infrastructure projects, bridges, road schemes. The large-scale civic engineering that required on-site presence for weeks at a stretch. He and Maya had found a rhythm around this. The logistics of his absences managed, the communication maintained, the relationship sustained across the distance in the practical way of 2 people who had decided that the work was worth the management. Maya was good at being alone. She had been doing it in versions since her mid-20s. She had Brody. She had her school. She had her mother 20 minutes away and a close enough network of friends that alone did not mean isolated. The pregnancy had been planned and straightforward. She had continued teaching until 34 weeks, had taken the remaining weeks to prepare the house and herself, had approached the final month with the organized calm that was her default mode for anything significant. Joel had come home 2 weeks before the due date. He was due back on site the Thursday after the birth, a timeline that Maya had accepted because the project deadline was fixed and because she was, as she always was, capable of managing. Brody had spent the final weeks of the pregnancy in a state of heightened attention. Maya had noticed this without giving it much weight. He followed her more closely than usual, checked on her more frequently, had taken to sleeping beside her bed rather than in his basket in the hallway. She had attributed it to the physical changes of late pregnancy, the different smells, the different sounds her body was making. She had not connected it to what came after. She connected it later. Later, she connected everything. Day 1. Maya's mother. Patricia, a capable woman of 60, one who had raised 2 children, and who had been looking forward to this grandchild with a specific and uncomplicated joy, arrived at 2 o'clock with food and practical help and the specific energy of a grandmother on the first day. Brody met her at the door as he always did, friendly, tail moving, the standard greeting of a dog who knows this person and is pleased to see her. Then she moved toward Caleb. Brody moved first. He positioned himself between Patricia and the Moses basket with the calm deliberateness of a dog executing a decision. Not a sound, not a signal of aggression, just a large golden dog standing in the exact space that Patricia needed to occupy to reach the baby. Patricia stepped left. Brody stepped left. Patricia stepped right. Brody stepped right. Brody, Maya said. Move. Brody looked at Maya. He did not move. Maya lifted Caleb herself and brought him to Patricia. Brody watched, alert, present, his eyes on the baby in Patricia's arms, but did not intervene once Maya was holding Caleb as well. He's protective, Patricia said. New baby. It's natural. He's never been protective of anything, Maya said. Day 2, the health visitor arrived at 10. Her name was Diane, 14 years in the role. A woman who had been into more new baby households than she could count, and who had the specific calibrated attention of someone who notices the things that new parents, deep in exhaustion and love, sometimes cannot. Brody met her at the door. He was friendly. He remembered her from the home visit at 36 weeks. Then she moved toward Caleb. Brody moved first. Diane had been doing this for 14 years. She had seen new, baby dog behavior in many forms. She stopped. She did not push through. She watched Brody for a moment with the professional attention of someone filing something away. She completed the visit with Maya handling Caleb throughout. She noted Brody's behavior in her visit record, not as a concern, not yet, just as an observation, a dog that would not allow approach to the infant by anyone except the parents. She noted the selectivity, parents yes, everyone else no. Day 3, Joel was leaving on Thursday. It was Wednesday. He was in the house for the last full day before the site. Maya's mother came again in the morning. Brody blocked her again. Joel watched this happen with the specific attention of an engineer observing a system behaving in a way he needed to understand. His resource guarding, Joel said. The baby is a resource. He's guarding it. We need to correct it before it becomes a problem. Maya looked at Brody. At the dog she had trained from 8 weeks, the dog who had never guarded anything in 3 years. He's not guarding, she said. She did not have a better word yet. He's something else. He's blocking everyone from getting to the baby. He's blocking everyone except us. Joel thought about this. Why us? He said. Maya did not have an answer. Diane, the health visitor, called at 11. She said, "I want to ask you something, and I want you to know it's probably nothing. Has Caleb been unsettled? Crying more than you'd expect? Any signs of discomfort when he's handled?" Maya thought about the past 3 days, about Caleb's crying, which she had attributed to the standard adjustment of a newborn, the hunger and the wind, and the new world overwhelm of a body learning to exist outside the place it had been made. "A cries when he's lifted sometimes," she said slowly. "I thought it was wind." A pause. "I want to refer you to the pediatric team," Diane said. "Just to check. It's probably nothing. But the dog, the way he's positioning himself, I've been doing this for 14 years, and I've not seen it before. Not like this. Not this specific." "What do you think it means?" Maya said. "I don't know," Diane said. "But I think it means something." The pediatric appointment was the following morning. Dr. Priya Nair was the consultant pediatrician on duty, a woman of precise and unhurried clinical thoroughness who had been in pediatric medicine for 17 years and who examined Caleb with the specific quality of attention that experience either produces or fails to produce, and in her case had. She had read Diane's referral notes before the appointment. She had noted the dog behavior. She examined Caleb systematically, the standard checks, the reflexes, the tone, the responses. She was gentle. She was thorough. She moved to the limbs. She palpated Caleb's left arm with the careful pressure of a clinician who knows that what she is looking for is subtle. Caleb cried. Not the standard newborn cry of a baby who dislikes being handled. Something more specific. A cry with a pitch and a quality that Dr. Nair noted and did not react to visibly, but registered with complete attention. She continued the examination. She ordered the X-ray before she said anything to Maya. The X-ray showed 3 fractures. A healing fracture of the left radius, old enough to have begun knitting, sustained in the first days after birth. A fracture of the 4th rib on the right side. A fracture of the left femur, the smallest of the 3, the most recent. 3 fractures in a 6-week-old baby that had not been identified at birth, had not presented with the symptoms that typically flag them, had been carried and handled and dressed and bathed without anyone knowing they were there, because the baby had not been able to say where it hurt. He had only been able to cry, and the crying had sounded, to every adult in the room, like the standard crying of a newborn. Dr. Nair sat with Maya and Joel in the consulting room. She explained osteogenesis imperfecta, brittle bone disease, a genetic condition affecting collagen production, the specific vulnerability of bones that had not received the structural protein they needed to develop typical density. In its milder forms, it was manageable. In its more severe forms, it required significant adjustment to handling, to care, to the entire physical relationship between a baby and the people caring for it. Caleb's presentation was moderate, manageable. With the right knowledge and the right approach, his life would not be defined by the condition. But the fractures needed treatment, and the handling needed to change immediately. Maya sat in the consulting room and heard all of this, and was very still in the way of a person receiving information that is rearranging everything. She thought about the 3 days. She thought about Brody between her mother and the Moses basket. Between Diane and the Moses basket. Between Patricia and the Moses basket. She thought about Joel saying resource guarding, and herself saying something else. "The dog," she said. Dr. Nair looked at her. Diane mentioned him in her notes. Dr. Nair said carefully. The behavior, the selectivity. He wouldn't let anyone near Caleb, Maya said. Anyone except us. For 3 days, yes, Dr. Nair said. Anu, Maya said. Dr. Nair was quiet for a moment. He knew something, she said. Whether he understood it, the way we understand things, that is a more complicated question. But something in Caleb's presentation was communicating to the dog that the baby needed protecting from handling, from being lifted by people who didn't know how to lift him safely. Maya looked at Joel. Joel looked at Maya. They were both thinking the same thing. Brody had let them lift Caleb. Only them. The two people in the house who held Caleb most often, most carefully, most consistently, who had, without knowing it, developed a handling pattern that minimized the pressure on bones they didn't know were fragile. The dog had known the difference. For 3 days the dog had known the difference. And on day 3 a health visitor had mentioned it. And a doctor had ordered an X-ray, and 3 fractures had been found. If Diane hadn't flagged it, Maya said. She stopped. She did flag it. Dr. Nair said. Because of the dog. Maya said. Because of the dog. Dr. Nair said. We want to stop here. Because what just happened in that consulting room is not a miracle in the way people use that word as something outside explanation, outside mechanism, outside science. It is a miracle in the more precise sense. Something real happened that we did not yet have the language to describe. And now we do. Brody heard something in Caleb's body that no adult in the room could hear. The specific vocalization frequencies of an infant in chronic pain. The biological stress markers that a body produces when it hurts. The cortisol, the altered breath composition, the micro movements of a baby trying to protect a fracture it cannot name. These signals fall below conscious human perception. They do not fall below a dog's. And Brody, who had never been protective of anything in 3 years, had responded to those signals in the only way available to him. He had stood between the baby and the people who didn't know how to hold him safely. For 3 days, until someone listened. Tell us in the comments, has a dog ever positioned itself between a baby or a child and something you couldn't identify as a threat? Not aggression, just a presence, a persistence, an immovable golden dog standing in a doorway. Tell us. Because Joel is about to say something to Brody that he has been needing to say since day 1. And then the hospital has some questions about how 3 fractures went undetected. And those questions are going to be harder than anything that came before. The hospital's safeguarding protocol was automatic. 3 unexplained fractures in a 6-week-old infant required investigation. This was not a judgment. It was a process, a careful, necessary process that existed because unexplained fractures in infants sometimes had explanations that required intervention of a different kind entirely. Maya and Joel understood this intellectually. They did not find it easy. The safeguarding team was thorough and professional and as humane as the process allowed. They interviewed Maya and Joel separately. They reviewed the birth records, the health visitor notes, the GP records. They spoke to Patricia, Maya's mother, and to Diane. Diane's notes were specific and detailed. She had documented the dog's behavior on day 2. She had documented her call to Maya on day 3. She had documented the referral and her reasoning. The safeguarding lead, a woman named Karen who had been in this role for 9 years, and who had the specific quality of a person who has learned to hold complexity without resolving it prematurely. Read Diane's notes twice. She requested a meeting with Dr. Nair, the dog. Karen said. Yes, Dr. Nair said. You're attributing clinical significance to a dog's behavior. I'm noting that a health visitor with 14 years of experience found the behavior significant enough to make a referral. Dr. Nair said. And that the referral led to the identification of 3 fractures in an infant who was not otherwise presenting with symptoms that would have triggered investigation. Karen read the notes again. The fractures, she said, the OI diagnosis, the handling implications. None of this was identifiable before the X-ray. Osteogenesis imperfecta at this grade can present with fractures that do not produce the acute distress response you would expect in a typical infant. Dr. Nair said. The pain signals are present. They are simply not in the register that human adults are trained to recognize as pain. But the dog recognized them, Karen said. The dog responded to them, Dr. Nair said carefully. Whether that constitutes recognition in the way we use the word is a question for researchers. What it constitutes clinically is an alert that a trained professional took seriously. Karen closed the file. The safeguarding investigation concluded that there was no evidence of non-accidental injury. The fractures were consistent with the OI diagnosis, with the specific vulnerability of bones that had not received adequate collagen support, and that had sustained injury through handling that would not have harmed a typical infant. Maya and Joel were cleared fully and without reservation. Karen, in her closing notes, wrote one additional line. She wrote, "The role of the family dog in alerting the health visitor to the infant's condition warrants further documentation. Recommend referral to pediatric research team." She had not written anything like that before. She did not think she would write anything like it again. But she wrote it because 14 years of experience had told Diane something was wrong, and 3 years of living with a family had told Brody the same thing. And both of them had been right. Joel went back to site on the Thursday as planned. He had not wanted to go. He had sat with Maya on the Wednesday evening, after the hospital, and the safeguarding interview, and the diagnosis, and the specific accumulated weight of the 4 days since Caleb had come home, and he had said, "I can stay." Maya had said, "Go. We'll be fine." She had meant it when she said it. The first week after Joel left was the hardest week of Maya's life. Not because of the practical demands. She was capable. She had managed alone before. She had Brody, and she had her mother, and she had the OI team's detailed handling guidance, which she had read and reread until she could have recited it. Because of the fear, the specific, constant, recalibrated fear of a parent who now knew that her baby's bones could fracture under pressure she could not see or predict, who had been lifting and bathing and dressing Caleb for 6 weeks without knowing, who had 3 healing fractures as evidence of what not knowing looked like. She was afraid to lift him. She was afraid in the specific paralyzing way that makes the necessary thing feel impossible. The way that anxiety takes an action you have been performing automatically and fills it with the weight of everything that could go wrong. She called the OI specialist nurse on the Tuesday morning. She said, "I'm afraid to pick him up." The specialist nurse, a woman named Roz, who had been in this role for 11 years and who had spoken to many parents in this specific position, said, "I know. That's completely normal. Let's talk through the handling technique again. Step by step, and then you're going to pick him up while we're on the phone." Maya picked him up. Caleb did not cry. She stood in the nursery with her son in her arms and felt something she could not name, not relief exactly, something more complicated. The specific sensation of a fear confronted and not resolved but survived. Brody was beside her. He had been beside her every time she handled Caleb since the diagnosis. Not blocking, not positioning, just present, close, attentive. His eyes on the baby in her arms, with the focused quality she now understood differently than she had on day one. "You knew," she said to him. Brody looked at her. "You knew the whole time." He put his head against her leg. She stood in the nursery with her son in her arms and her dog against her leg and understood, for the first time, what the 3 days had been. Not a mystery, a warning, given in the only language available, given until someone listened. She called Joel that evening. "We're okay," she said. "You sure?" he said. "Brody's here," she said. A pause. "Okay," Joel said. "Then you're okay." Diane wrote the case study. She had never written a case study before. She was a health visitor, not a researcher. Her work was in homes, not in journals, in the specific practical human territory of new families and new babies, and the 14 years of accumulated instinct that had told her, on day 2, to file something away. She wrote it because Dr. Nair asked her to. Dr. Nair had contacted her 3 weeks after the appointment. She had been in touch with a researcher, Dr. Kofi Mensah, at the university's Department of Pediatric Pain Research, who had been studying non-verbal pain communication in pre-linguistic infants and who had expressed significant interest in the documented case. Diane's 14 years of field notes were, Dr. Nair said, the most detailed first-person account of the dog's behavior available. Diane had written it at her kitchen table over 3 evenings. She had written it simply, in the language of a practitioner rather than a researcher, what she had observed, when she had observed it, what she had decided to do with the observation, and why. She had written, "I have been asked what made me take the dog's behavior seriously. The honest answer is that I didn't know why I took it seriously. I only knew that a dog who had never been protective of anything was suddenly protecting something, and that the protection was specific rather than general, and that in 14 years I had learned that specific, persistent, unexplained behavior in an animal around an infant is worth a phone call." Dr. Mensah had read the case study and called her the same day. He said, "This is exactly what we have been looking for. A documented, timestamp, professionally observed account of canine pain, signal detection in a pre-linguistic infant with an undiagnosed skeletal condition. Do you understand what this means?" Diane had said, "I think so. It means," Dr. Mensah said, "that we now have the foundation for a research protocol. We can study this. We can document it formally. We can build toward a point where health visitors are trained to ask about dog behavior as a routine part of the neonatal assessment." Diane had been quiet for a moment. "A phone call?" she said. "That's all I did. I made a phone call." "You made a phone call?" "Doctor," Mensah said, "because you took a dog seriously. That is not a small thing." The story reached the OI support community through Maya. She had joined the community in the first week after the diagnosis, a closed online group of families navigating osteogenesis imperfecta, a place of practical information and mutual recognition, and the specific solidarity of people managing something the wider world did not always understand. She posted Caleb's story 3 weeks after the diagnosis. Simply, specifically, with the detail that mattered. The responses came from places she expected and places she did not. From OI families, immediate, numerous. Parents who had received the diagnosis late, after fractures had occurred, after the specific anguish of not knowing. Who read Maya's post and understood what Brody had done, and from other families. Families with no OI connection, who had had dogs behave unusually around their infants, and had not known what to do with the behavior. One message came from a woman named Sian in Wales. She wrote, "Our Labrador did something similar when our son was 3 weeks old. We thought it was jealousy. We never investigated. Our son was diagnosed with a hip condition at 8 months that the consultant said had almost certainly been present from birth. I have thought about the dog every day since I read your post. I am going to think about him differently now." Maya read this message and then read it again. She showed it to Joel on their next call. Joel read it. He did not say anything for a long moment. Then he said, "I need to make sure people know. About Brody. About what he did. About what Diane did with it." "I know," Maya said, "because Sian's dog tried." Joel said, "And nobody listened." "I know," Maya said again. "We were nearly Sian," Joel said. Maya looked at Brody, who was beside Caleb's bouncy chair in the position he always took now, close, present, watchful in the easy way of a dog whose job has become something he understands. "We were nearly Sian," she said. "Dean made the difference." Dr. Mensa's paper was published 9 months after Caleb's diagnosis. It was co-authored with Dr. Nair, with Diane as a named clinical contributor, and with input from a veterinary behaviorist named Dohat. Asha Patel, who had been studying canine pain signal detection for 6 years, and whose existing research provided the mechanistic foundation for what the paper documented. The paper was titled "Canine Detection of Chronic Pain Signals in Pre-Linguistic Infants, a documented case study of protective behavior in a domestic dog preceding the diagnosis of osteogenesis imperfecta." It described the mechanism in the language that research requires and that the mechanism deserved. Dogs, Dr. Patel's work established, detect pain in other animals and in humans through a combination of vocalization frequency analysis, biochemical signal detection, and the specific micro-movement patterns of a body protecting an injury. Infants in chronic pain produce signals in all 3 channels. The vocalization frequencies that indicate pain in a pre-linguistic infant, too subtle for human adults to consciously distinguish from standard crying, fall within a range that dogs process with clarity. The biochemical compounds that chronic pain releases into breath and skin are detectable to a dog at concentrations far below human olfactory threshold. And the specific way Caleb had moved, the micro-protective adjustments of a baby with 3 fractures, the slight asymmetry, the particular resistance to certain handling positions, had communicated to Brody, in the channel dog's use, that something was wrong. Brody had not understood osteogenesis imperfecta. He had understood this baby is hurting, and the people who are coming to lift him do not know how to lift him safely. And the people who live here, who have held him most, who have learned, without knowing it, the handling pattern that minimizes his pain. Those are the people who should be lifting him. And so he had stood between the baby and everyone else for 3 days, until Diane made a phone call. The paper's recommendations included a protocol developed with Diane's health visiting team as the pilot for the routine documentation of unusual pet behavior during neonatal home visits. A single question added to the standard assessment. Has the family pet shown any unusual or persistent behavior around the infant since birth? A single question. Diane had piloted it for 6 months by the time the paper was published. In 6 months, the question had prompted 3 additional investigations. 2 had found nothing of clinical significance. 1 had found something. Caleb was 10 months old when the paper came out. He was, at 10 months, doing what 10-month-olds do, pulling himself up on the furniture with the cheerful determination of a baby who has decided that standing is the next frontier. His OI management was established, his handling protocol understood by everyone in his life, his fracture risk known and managed rather than unknown and ignored. He was, in the word the OI specialist used at his 10-month review, thriving. Brody was beside him when he pulled himself up for the first time. He wobbled. Brody moved slightly, not to catch him. Not quite, but to be in the right place if catching was needed. Caleb steadied. He looked at Brody with the specific delighted attention of a baby who has been looking at this dog his entire life. He reached out and grabbed Brody's ear. Brody did not move. Maya watched from the doorway. She thought about day 1, about her mother reaching for the Moses basket, and Brody stepping left when she stepped left. She thought about Diane on the phone on day 3. She thought about the X-ray. She thought about Sion's Labrador, who had tried and not been heard. She thought we heard you. She thought eventually we heard you. She thought it was almost not enough. She thought it was exactly enough. Summer came to the house in the specific way it comes when there is a baby learning to move in it, with a new geography. The floor suddenly important, the world reorganized around a small person discovering that it extends in all directions. Caleb was 14 months old. He was walking, not steadily, with the specific lurching confidence of a toddler who has decided that falling is a price worth paying for the upright view. His OI management meant that falls required attention and certain surfaces required padding, and there was a level of vigilance in the house that was simply part of the life. Now, present, managed, not consuming. He fell toward Brody more than toward anything else. Brody absorbed this with the patient steadiness of a large dog who has decided that this small person is his specific responsibility, and that the responsibility includes being fallen on. Joel was home for the summer. A longer stretch than usual. The project had finished, the next one not starting until September. A window of ordinary life that both of them were spending with the conscious deliberateness of people who know that ordinary is not guaranteed. They were in the garden on a Saturday afternoon. Caleb on the grass, Brody beside him. Joel and Maya in the chairs with the specific quality of attention that parents of toddlers develop, monitoring without hovering, present without performing presence. Caleb fell. Brody was there before either of them moved. Not catching him, the fall was small, the grass soft, the landing fine. Just there, beside him, checking. Caleb looked at Brody from the grass. He laughed. He put both hands on Brody's face, the clumsy, affectionate, entirely confident grip of a child who has never once been given a reason to be uncertain about this dog, and looked at him. Brody looked back. His tail moved. Joel watched this from the garden chair. He thought about day 3, about coming home from sight to find Maya shaken and Caleb at the hospital and Brody at the door with the expression that Joel had read. On day 1, as resource guarding, he thought about what he had said. Resource guarding. Correct it before it becomes a problem. He thought about what Maya had said. Something else. She had been right. He had said this to Brody the evening after the hospital. He had sat on the kitchen floor, the same floor where Maya had first brought Brody home, where the puppy had climbed onto Joel's lap, and he had put his hand on the dog's head. "I was wrong," he had said, "about what you were doing. I was wrong, and you were right, and I'm sorry it took us 3 days." Brody had looked at him. His tail had moved once. Joel had sat on the kitchen floor with his hand on his dog's head for a long time. In the garden now, watching Caleb laugh at Brody from the grass, Joel thought about all the things that had to happen in exactly the right order. Brody knowing, Diane noticing, the phone call, the X-ray, the 3 fractures found in time. He thought about Sian's Labrador. He thought about all the dogs who had tried. He thought we were lucky. He thought lucky is not the right word. He thought Diane made the difference. Brody made it possible for Diane to make the difference. He thought that is the right word. Possible. Caleb looked up from the grass. He looked at Joel. "Day," he said, clearly, directly. Joel looked at his son. "Yeah," he said. "I'm here." Brody's tail moved. The afternoon light was on all 3 of them. What had been possible? What had become? The dog had never been protective of anything in 3 years. From the moment they brought the baby home, he wouldn't let anyone near him, not aggressively, not with a growl or a raised hackle or any signal that a human adult would read as danger, just immovably, specifically, for 3 days, until a health visitor made a phone call, until a doctor ordered an X-ray, until 3 fractures were found in a baby who had been hurting in a register that no adult in the room could hear. Brody heard it from the first day. He stood between the baby and everyone who didn't know how to hold him safely, and he did not move until someone listened. That is not a story about a remarkable dog. That is a story about what dogs can do that we are only beginning to document, about the pain signals that fall below human perception and above canine detection threshold, about the specific, replicable, scientifically grounded capacity of a bonded dog to know that something is wrong before the people in the room can name what it is. And it is a story about Diane, who took a dog seriously, who made a phone call, who added 1 question to a standard assessment and changed what was possible. Share this video today. Share it with every new parent, with every health visitor and midwife and pediatric nurse, with every family that has a dog and a baby in the same house and has been watching the dog behave in a way they cannot explain, because Sian's Labrador tried and nobody listened. Don't be Sian. Subscribe if you are new here. We are back every week. Ring the bell. And our final question, the one we want you to sit with today: has your dog ever tried to tell you something you weren't ready to hear? Not a bark at the door, not a growl at a stranger, something quieter than that, something specific, something that didn't fit the dog you knew. Tell us in the comments. Because Brody didn't have words, he had 3 days and a health visitor who was paying attention, and that was exactly enough.